Okay, so I'm going to go ahead and get started, everyone. So thank you so much for coming to this presentation on upcoming changes to Medicaid and home care, presented by Legal Health. We're a division of NYLAG, providing free legal assistance and working on policy for New Yorkers with serious or chronic health problems, working with our wonderful partners in the healthcare setting. So the objectives of this training. First, we'll start with a review of some Medicaid and home care basics. We will then discuss the first major change that's starting in May, which is a change to the home care assessment process. And finally, we'll review some future changes to Medicaid and home care rules. So there's two major eligibility categories for Medicaid in New York State. There's modified adjusted gross income or MAGI Medicaid, and then everything else non-MAGI Medicaid. So the MAGI Medicaid population is anyone under 65, including if you're disabled but not on Medicare. Parents and caretaker relatives, even if they do have Medicare, are over age 65. And pregnant women and children. MAGI recipients are eligible at 138% of the federal poverty level for their income. And that would be $1,563 this year for a single person, and the limits are higher for couples and larger families. Pregnant women and children have even higher income limits, and there's no resource or asset test for MAGI Medicaid. So you can have any amount of money in the bank, you can have a second car, it's not a problem for MAGI Medicaid. For non-MAGI Medicaid, this is the population of the disabled with Medicare, those 65 and over, and the blind. The income limit for non-MAGI Medicaid this year is quite low. It's a lot lower than MAGI Medicaid. And so it's $934 per month for a single person, a little bit higher for couples. There's a $16,800 resource limit. So that's the total amount you can have in savings and assets. There are some exceptions for certain types of assets. So it can get a bit complex for non-MAGI Medicaid. There are also some special budgetary rules that apply, like spousal refusal, qualifying with a spend down or qualifying with excess income, and certain types of trusts. So there's some great new changes coming up, some good news finally for next year. So in the most recent state budget, Governor Hochul made a number of expansions to Medicaid eligibility. And as long as these are approved by the federal government, they will start January 1st of next year. So the budget raises the income limit for the non-MAGI group, the disabled, aged, and blind, to 138% of the federal poverty level. So basically matching the MAGI level. So there won't be any difference in income limits. It also raises the resource limit for that population. And so it's going to go up considerably to $28,134 for singles. And finally, it makes undocumented immigrants ages 65 and over eligible for Medicaid fully, regardless of their immigration status, as long as they meet the other eligibility criteria. So, you know, the really great thing that this change does, one of them is that there were a lot of individuals who would qualify when they were under 65 for Medicaid because they had that higher income limit. And then as soon as they turned 65, the income limit that they were subject to just drastically dropped. And so they would lose their Medicaid eligibility. Even though their income didn't change, the income limit for Medicaid did. And so those individuals will no longer lose their eligibility. If you're eligible for Medicaid under age 65, you should continue to be eligible over age 65. So just to go over some of the special eligibility rules. So the first is spousal refusal. This is where a spouse refuses to support a patient's care financially. And that allows a patient to be budgeted as single by New York City Human Resources Administration. That's a really great strategy for anyone who needs Medicaid and doesn't themselves have much income, but their spouse does and disqualifies them. So if their budget is single, they can qualify for Medicaid. Another special rule for married couples is spousal impoverishment. This is where only one of the couple needs the long-term care services like home care. It allows that patient to qualify with a higher income limit and a higher resource limit. And finally, the last strategy is the pooled income trust. So for patients who qualify for Medicaid with a spend down, the excess income is placed in the trust each month over what the Medicaid income limit says they're allowed to have. And then that money goes into the trust each month and can be used to pay that patient's living expenses. The patient can direct where they want that money to be sent. You can't use both spousal impoverishment and pooled income trust. You have to choose one. So what is home care? So home care is the assistance of an aide or attendant with certain activities. So nutritional, environmental support, and personal care functions is the official definition. And this can be provided two ways. The first way is sort of the traditional agency model called personal care services. And that's where the patient doesn't know or doesn't choose their own aide. The plan sends them an aide from an agency. The other model is consumer-directed personal assistance. So this is where the Medicaid recipient is able to choose their own aide and can use a family member other than a spouse. So this distinction between activities of daily living and instrumental activities of daily living is going to become important later when we talk about some of the changes. So I just want to cover this. So activities of daily living are the really core personal care activities. Bathing, dressing, feeding, toileting, something someone does in the home regarding their own person. Instrumental activities are more what we would think of as chores or housekeeping tasks. So shopping, transportation, cooking, etc. So Medicaid automatically covers home care for MAGI individuals. So if you are under 65, if you're MAGI and you qualify for Medicaid, you also automatically qualify for home care because there's no asset test or anything. On the other hand, there's an extra step sort of to the Medicaid application for non-MAGI individuals. So those 65 and over are disabled to qualify. They have to submit what's called a Supplement A form with their Medicaid application, and just that documents the amount of their resources, and that allows them to qualify financially for home care. You may have heard of some upcoming changes regarding a transfer penalty. In a sort of look back period. We're not going to be covering that in this presentation, and there's no implementation date yet for that change. So what we're doing now is sort of the current state of how to qualify for home care. So most, home care recipients in New York do receive their services through a managed plan, a Medicaid managed plan. There's different types. So for individuals who really just want to add on home care and then keep everything else the same, they can choose what's called a partial capitation MLTC plan. Now, this type of plan allows them to keep their original Medicare or Medicare Advantage plan that they already had the same. They don't have to make any changes to that. They just add on a new plan that's only covering the home care and a few other services through Medicaid. The other major type of plan, and there's different sort of options for this type, is combining Medicaid and Medicare coverage, and it covers all medical and home care services in one combined plan. and patients do have to stay in network with their providers. And you have to obviously be dual eligible to enroll in this type of plan. So how can a patient receive home care really quickly? Is there a way? And luckily right now there is a way to receive home care with a very quick time frame, and it's called the immediate need application process. This is an application that's submitted to Human Resources in New York City. And it consists of a cover letter, a form where the patient signs and says, I need home care immediately, and most importantly, the doctor's order for home care. So this can be used by a patient who's already in the community and needs home care urgently, or even if they're wanting discharge from a hospital or a nursing facility. They can apply for this type of authorization. And if they don't already have Medicaid, this is the absolute fastest way to get a Medicaid eligibility determination. Medicaid eligibility must be decided within 7 days. So they can submit that Medicaid application along with this immediate need attestation form. And within 7 days, they should have a decision on their Medicaid application. And then within 12 days, they should be receiving the home care services. And this is a much faster alternative to the typical enrollment process in one of those plans that was already, discussed. Either the partial capitation or the dual eligible plans both take much longer to enroll in than the immediate need application process. A lot of patients also need our help with requesting more hours of home care than they're currently receiving. So this type of request is called a concurrent review. And the concurrent review request can be expedited if you can show that the delay would jeopardize your life or health or your ability to attain, maintain, or regain maximum function. And so the expedited time frame is 72 hours. Even faster if it's following an inpatient admission. Now, plans can say, oh, we need more time to decide this request, and there's certain reasons that they can try to say that. We already discussed consumer-directed personal assistance. So in addition to allowing patients to choose their own aides, the other great thing about this type of service is that the aides can actually do a larger range of tasks, including some skilled tasks. So although they're not nurses, they can't do nursing tasks, they can do some skilled tasks that a normal personal care aide wouldn't be able to do, like medication administration. So that was just giving an overview of the home care landscape. Really just sort of talking about some strategies for enrollment and the different types of services. I'm just going to see if there's any questions in the chat since this is a town hall. Community health worker at NCB Hospital asked how would we be able to refer our patients to receive urgent home care through immediate need home care application. So a referral can certainly go through LegalHealth, and each hospital has a process. And so if you don't know what the process is for your hospital, you can either contact the head of your social work department or you can reach out to us regarding that referral. Marnie asked, can the concurrent review be requested if the patient is currently hospitalized? Great question. Absolutely. It can be requested in the hospital before discharge. So if the patient, was receiving, like, let's say 5 hours a day, but they're going to need, 10, absolutely, you can request that from the hospital before they're discharged. August asks, what if a person is a domestic partner? Can they still be a CDPAP aide? So yes, it's only spouses who are excluded. So if they are just living with the person, that's fine. They can be the CDPAP aide. Monica asked, where is the immediate need Medicaid app e-faxed? So there's a certain EFACT number for the unit of immediate needs that it goes to. And then I can actually send that along with the slides because I see that there's a lot of questions about immediate needs. So I'll just send that EFACT number along with the slides when these are sent out. Great, so I'm going to go on to the next section, and that's regarding the new home care assessment process. So this was going to start May 1st, but it's been pushed back a bit to May 16th. And it's going to be a phased in implementation. So different aspects of this are going to be implemented different dates. It gets a little confusing, but I'm going to try to break it down for you. So this change, and most of the changes we're discussing today, all come from the 2020 to 2021 New York State budget. That budget was trying to save a lot of money in the home care realm. And so it was making a lot of cuts and a lot of changes to home care. So the first major change to be implemented out of this budget is the new independent assessment process for home care eligibility. It's going to be phased in starting May 16th. So right around the corner. And this is really going to reduce the role of the patient's own doctor and the managed care plan in making sort of decisions about the services. So to break this down into steps, so the new independent assessment process has two assessments. So the first assessment, the New York Medicaid Choice nurse is going to conduct a nursing assessment, either in person or by telehealth. It can't be by telephone, but it can be by video. And then the second assessment, second step, is that independent physician, nurse practitioner, medical professional associated with New York Medicaid Choice is going to conduct a medical assessment and order the home care on their own order form. And then these two assessments are going to be used by either the MLTC plan that the person's in, or if they're with immediate needs, by HRA, to determine how many, the number of home care hours they're going to receive, as well as whether they're eligible for home care. Yes or no, are they eligible for home care? So as I said, this is going to be phased in stages. So I'm going to go through stage by stage. So the first stage, starting May 16th, it applies to first-time requests for home care. Enrollment into any type of managed long-term care plan, first-time requests in mainstream Medicaid-only managed care plans, and then also to those receiving home care fee for service. So if a patient, after May 16th is wanting to enroll, for example, into an MLTC plan for the first time ever, this new process is going to apply to them, this two-step independent assessment system, and they can call New York Medicaid Choice to start off this process to request these assessments to be conducted. And New York Medicaid Choice will, on the phone, schedule those assessments with them, both the nursing and the medical. Now, the second stage is starting July 1st, and that applies to any expedited request for home care. So it applies to immediate need applications through HRA, and also to expedited requests if someone's in a mainstream Medicaid only managed care plan and wanting home care for the first time, but needs it really soon. It will start July 1st. And the reason being probably that New York Medicaid Choice needs more time to really hire the staff they need to expedite these assessment procedures. So they're giving them a little bit of time to get themselves together and get what they need. And so that's going to start July 1st. So if a patient is applying for home care for the first time through the immediate need process, what should they do? So they should still apply through HRA the same way that they do now with the EFACTs and all the application forms. And then what we've been told is that HRA will make a three-way call with New York Medicaid Choice to schedule that assessment, both assessments on a really expedited basis. And then finally, New York Medicaid Choice is going to start taking over the annual reassessments for those already receiving services and also all requests for increase in services or discharge from nursing home or hospital. Now, this phase does not have an implementation date yet. So it's going to come sometime after July. And for these requests, the plan, when you request the increase or when the annual reassessment is due, the plan really should be coordinating with New York Medicaid Choice to get these assessments done. So here we have a sample assessment tool for home care. Now, this is a sample that is from a plan. New York Medicaid Choice will have their own uniform assessment tool that they're going to use for all of these assessments across all plans and types of sort of cases. And this is just an example to show you some of the different activities, how they're broken down, and some of the different functional levels and what those mean. So you'll notice on the left that we have different activities of daily living. Just some of these include like bathing, dressing upper body, dressing lower body. It's all broken down and defined. And then on the right side, we have the functional level, different levels of assistance. So, you know, supervision, independent, limited, extensive, and what those mean, their definitions. So a nurse doing the assessment, that's what they're going to primarily be looking for. Which ADLs does the person need help with, and what level of assistance do they need help with? And so we're going to be going over after this section with some changes in eligibility. So just keep this in mind. This is going to become important in a while. So let's do a case study. And if you would like, you can unmute yourself to answer these questions that I'm going to read out, or you can just drop some thoughts in the chat. So case study for Miriam. So Miriam is applying for home care for the first time after July. I did it after July because all of the changes will be in effect then. So how does she start the enrollment process? Like, what are her options? And if she asks, you know, how long will this take? How soon can I get home care? What would you tell her? And also, do you think there's anything that the doctor can do to advocate for her? Okay, so I see Abraham raise his hand. If you want to go ahead and unmute yourself, Abraham, you can give some thoughts.
Yeah, so in this case, not saying like she's being hospitalized or she's in the hospital or not.
Can't quite hear you.
Can you hear me now?
Yeah, now I can.
Okay. Yes, so I take it I don't believe they're in the hospital or such, so they can call NYCNC and I guess ask for immediate home care due to their condition, things of that sort.
Okay.
Also can reach out to HRA and then they can.
Yes. So those are really the different ways. One way would be through New York Medicaid Choice, applying to join the MLTC plan and getting those assessments started, or also applying to immediate needs process through HRA would be even faster. So if she really needs it urgently, do the immediate needs, absolutely. And I see Rodenko has the hand raised, so if you want to unmute yourself.
Yeah, sure. So taking into the account that this is the first time that she's applying for the home care service. So just how Mr. Ibrahim mentioned, so we can do the, just a regular process, put the application for the intake, and then go from there. Now, how long might this process take? We don't know that. That depends on a lot of different factors. Is there anything her own doctor can do? Well, there's always something they can do, right, in terms of any paperwork that they need to submit if there's a need for that. But one thing that's missing from this scenario here, and I think is very important, is her age. So I think those are the things that we can take into the account.
Okay, yeah, that's great. So yeah, the first step in determining whether she's even eligible for home care, of course, is she magi or non-magi? Like, what types of plans is she eligible to join? Exactly, absolutely. So just to go over, because I think Abraham and Rodenko, talked about how does she start the process really well. How long might this process take? Let's talk about the deadlines for these assessments. So shockingly, there are no deadlines given for New York Medicaid Choice conducting these two types of assessments, the nursing and the medical. The state hasn't given them any timeframes they have to comply with for conducting these two assessments. So we don't know how long this process could take once it started. There is a deadline for the plan, the managed plan or the Department of Social Services. They have to determine the number of hours the patient gets within 7 days. So 1 week of receiving those assessments back from New York Medicaid Choice. The assessment could also be redone. It could have to be redone if the plan or Department of Social Service disagrees with those assessments and thinks some mistake was made. In that case, the assessment has to be scheduled within 10 days. Now, the one caveat to this is that for the expedited requests, like immediate need, that deadline hasn't changed. That's set forth in the law. It's still 12 days after the application is filed that the services have to be provided. So if someone needs the care urgently, absolutely apply through the immediate need process so that person is able to do so. And then in terms of whether her own doctor can do anything, there's no requirement at any point in the normal standard process now for the doctor to submit any form or paperwork. However, the doctor can optionally write a letter of medical necessity to give to the New York Medicaid Choice nurse or their own doctor or even the managed long-term care plan. And it can just go through, the patient's need for home care. And we'll go over some tips for that type of letter. And that can be helpful, especially if the person is it's a bit iffy whether they need home care or not. And of course, the patient will have appeal and fair hearing rights if New York Medicaid Choice denies their eligibility for home care, or if the plan has any adverse action against the patient. And in any of these cases, we definitely recommend that you make a referral to LegalHealth for assistance regarding that appeal or fair hearing. So just some quick tips for doctors' letters. We would recommend that doctors be specific in their letters for medical necessity. So don't just list the diagnoses or medications, but specify how these diagnoses lead to the need for home care assistance with different ADLs. You can add the level of assistance that the patient needs with the activity. So just as an example, do they need contact guarding or hands-on assistance with walking? Also, if the patient does have a dementia diagnosis of any kind, you can address the need for cognitive cueing and prompting because that is a covered service. So if the patient needs to be reminded, for example, to use the walker, even if they don't need hands-on assistance, it's worth mentioning in the letter. And final tip is just don't overly focus on fall prevention, because safety supervision on its own, like just watching the patient to make sure that they don't fall or they don't turn on the stove, is not a covered service. So it has to be tied into an activity of daily living, like reminding to use the walker or contact guarding for balance. So the other major change that's coming up in May is changes to over 12-hour cases. So this is if the plan or HRA says that the patient needs more than 12 hours per day of home care, their case must be referred to an independent review panel. And this panel is going to be run by New York Medicaid Choice, and it's going to consist of doctors or other medical providers. And that panel's job is to decide whether to recommend, really, whether the plan of care for over 12 hours is reasonable and appropriate to maintain the patient's health and safety in their home. So they're going to either say, yes, we think that, the 24-hour living care recommended is a great idea and you should go forward with it, or they're going to say, no, we don't think that's a good idea. Maybe the patient should be in a nursing facility. Maybe they're not able to be maintained safely at home. Now, the plan or HRA is still going to make the final decision. So they'll take that recommendation into account, and they can either go with the recommendation or ignore it. And if the patient doesn't like that outcome, they can still appeal or request a fair hearing. Now, this is not going to apply to anyone already receiving more than 12 hours. So they're going to be grandfathered in. They're not going to have to go through this review panel. Okay, let's take a break for questions, and let me just monitor the chat and see what's come in. Okay, so Andrea mentioned that some health insurances, such as Health First, require the doctor to submit a statement or letter explaining the need for an increase. They will also send a nurse to the patient's home to assess them again. So absolutely, Andrea. So the plans usually send a nurse to reassess the patient if they request any kind of increase. And so sometime in the future, this independent assessment process is going to apply to that sort of procedure as well. So if the patient in the future, if the patient requests an increase, rather than the plan sending their own nurse, the plan's going to have to ask New York Medicaid Choice to send their nurse to do an assessment to see if the condition has changed. And doctor's letters are always, always helpful. August asked, what happens if the patient is nonverbal? Great question. So for any of these assessments, now or in the future with the independent process, the patient can have an advocate or family member at the assessment with them. And honestly, that's something I'd strongly recommend they do if they have someone in that role, whether they're nonverbal or not. Okay. Let's see. So also in the chat, I see a great link to a website, NYLC, that has all of the requirements for the immediate need application. Perfect. So I'm also going to send a link to that along with this. Okay, any other questions regarding this specific change to the independent assessment process that anyone wants to drop in to the chat or ask? Okay, moving on. So I'm just going to go over a few future changes to home care eligibility rules. Now, some of these don't have any implementation date yet, but it's just upcoming, and it's something that you can be thinking about for your patients. So the current policy on who qualifies for home care is that any level of assistance that someone needs with even one activity of daily living, like let's say getting dressed, that's enough to qualify for home care. And if the patient only needs assistance with IADLs or housekeeping, they can receive up to 8 hours per week of housekeeping services from CASA in New York City, paid for by Medicaid. So the future policy, it's currently on hold due to the COVID-19 health emergency. Once that health emergency is over, the New York State Department of Health should give an implementation date for these changes. So in the future, at some point, once COVID is over, they're going to require the patient to need at least limited assistance with at least 3 activities of daily living to qualify for home care. It's going to be a different rule if you have a dementia diagnosis. Those patients will need at least supervision with at least 2 activities of daily living to qualify for home care. Housekeeping only services will no longer be covered by Medicaid in New York. with the caveat that if you already were receiving the housekeeping, you'll be grandfathered in. So you'll keep your 8 hours a week, but if someone new is trying to get through the door and trying to receive housekeeping only, they won't qualify. So I want to do a case study just regarding these changes and how they might be implemented. Okay, so once again, you're welcome to raise your hand or type some thoughts in the chat regarding this case study. So I'm just going to read out the scenario. Juana's children have noticed that she's losing weight. That's the first thing they noticed when they visited her. So they decide to stay with her overnight, and they realize that she's really not cooking for herself. She's maybe just eating little snacks here and there, and she really needs to be reminded to eat meals. They've also noticed that she has difficulty lifting her arms to bathe and dress her upper body, although she's been trying her best. So do you think Juana would qualify for home care under the current rule? And what about under the future rule? And why or why not do you think she would qualify or not qualify? What are your thoughts? And remember that she needs at least three ADLs, at least limited assistance. If she has a dementia diagnosis, she needs at least 2 ADLs, at least supervision. So what are the thoughts? Brett said future with a possible dementia diagnosis. So that would put her in the other category of needing only 2 ADLs with supervision. Okay, that's a great thought. Anyone else have any thoughts about her eligibility for home care? Okay, Angelina said eating, limited upper body, and dressing, that's 3. Okay, so it seems like you think she would qualify even under the future system, dementia or no dementia. Anyone else have any thoughts on this prompt? Okay, Nefertiti thinks that she would qualify under both. Okay, so let me tell you what I think would happen. Under the current system, she would definitely qualify, undoubtedly, because she only needs any level of assistance with at least one activity. So let's say bathing, there she qualifies under the current rule. Now, under the future system, I think it really depends. It's a complicated question, actually, because there were 2 activities of daily living in the prompt that I mentioned: bathing and dressing upper body. Now, eating is a little more complicated. I'm going to get into that. So she definitely needs, assistance with bathing and dressing her upper body. If she has dementia, that would be enough to qualify her. She only needs 2. Now, what about if she doesn't have a diagnosis of dementia? Is there a 3rd ADL? Okay, cooking is not an activity of daily living. It would not count. So even if she cannot cook for herself, that's not an activity of daily living and it doesn't get her through the door. Now, my question is, why is she not eating? This is what would have to be, gone into by her care team, by her doctor, by her family. Is she not eating because she physically needs assistance or reminding to eat? Or is she not eating because she's not able to cook and so she has nothing there to eat? What is the reason? So I think we would need more information. And maybe she should be evaluated for dementia if she's not remembering to eat or not wanting to eat. So that way she could qualify. Because to me, this case seems like, yes, absolutely, Juana needs home care. But does she qualify under the future system? It's a little more complex. Does anyone else have any questions about that one? So my main advice then would be, if someone has any signs of dementia, even if it's early, maybe get them into a specialist referral. And then, definitely work with the doctor to nail down those needs for assistance with different ADLs. What does the patient actually need? Okay. An additional case study. So Victoria needs assistance with instrumental activities of daily living only, so housekeeping, cooking, shopping, so on and so forth. She's heard from her friends that they receive 8 hours of housekeeping services per week, all paid for by Medicaid. She comes to you and asks if you know how to apply for this service. So what would you do for Victoria? What would you recommend? Any thoughts? So right now, she does qualify for 8 hours of housekeeping from CASA through Medicaid. So she should go ahead and apply for that service with HRA right away if she needs it. Now, after the changes go into effect, she really has limited options to get that help with housekeeping. So one option is expanded in-home services for the elderly, ISEP, which is a cost-sharing service run by the Department for the Aging. Can apply for that by calling 311. Now, what I've heard about this program, though, is that it's very long waiting lists. It's very hard to get into this program, even now, without like a crush of people applying for it. So, although this is theoretically available to her, she might not actually get this assistance. So it's just something to keep in mind for the future, maybe getting some resources on where someone can get housekeeping services. And I believe Radenko raised his hand again. So if you would like to unmute yourself and share. Or maybe that was just from before. Okay, so just key takeaways.
Sorry, I'm having difficulties with the system. I'm back.
That's okay.
I actually had a question. So why are they making these changes? Because it is difficult as it is for these folks to get these services. Now, for us to explain to the patients that there are changes, they're going to have a really hard time and kind of adapting or perhaps adjusting to these new changes. So I guess the question is, what is the best approach for us to advise our patients? He may heard that Medicaid has changed the rules, so these are the things we need to take into the account for you to get the services. So how will we go about that?
Right. So I think that the main takeaway is if the person is able to apply now, they should, before the more restrictive criteria take effect. It's better to get in the door now than later, because a lot of the changes you'll be grandfathered in and you'll keep your more favorable rules. If that's not possible and the patient needs to apply after the more restrictive rules start, it's going to be a matter of making sure the doctor is very involved and writing letters of medical necessity.
Okay, and my follow-up question is, if I'm working with the patient and he or she has applied for these services, but as you know, to get this done, it takes forever. So what in the meantime, the new changes have taken the place and my patient is still in the process of getting the services under the old plan. Would that transition as I guess, under the old plan or the new plan?
Okay, so it depends. That's a tricky question. Because if you, for example, start by maybe applying for Medicaid and doing a pooled trust now, but only get the home care assessment after the changes go into effect, you'll be under the future rule. So it kind of depends at what stage they are in the process.
Okay,
when
thanks
it
so
takes
much.
effect. Yeah. Okay. Damien asked, are patients guaranteed coverage after changes if they are enrolled now? So, right. So I think what you're asking really is, so these more restrictive criteria for home care are going to go into effect in the future. If they enroll now, will they keep their home care even after the changes? So the answer is yes, they'll be grandfathered in. The old rule will apply to them. So it's better to apply now. Nefertiti asked Sarah, when does the changes go into place for housekeeping services, May or July? So neither. So that goes into effect only after COVID is over. So that's on hold right now due to COVID. So the section on home care eligibility rules and housekeeping, that is on hold due to COVID. Let's see. Okay. So the other thing I wanted to mention is that it's unclear how many delays this new assessment process of the independent assessor will cause. So we're very worried about delays because we don't know how New York Medicaid Choice is going to get their staffing in order to get all of these assessments done on time. So if patients experience delays, like really severe delays in getting home care in place, please do let us know, because you're really our eyes and ears, you know, with the patients. You know what's going on in terms of getting them this care. You know, you see it on the front line. So we need to know too, so that we can be better advocates for them. Does the person need to have an MLTC, or can they apply with only having Medicaid? So Medicaid only individuals are eligible for home care. So they can apply for home care. They can, if they're already in a mainstream Medicaid plan, they can call the plan and ask for home care. And starting May 16th, they'll still have to go through that new independent assessment process with the nurse and the doctor's assessment from New York Medicaid Choice. Okay. So just opening it up to a general Q&A session. This is the time that you can ask any questions about anything during the presentation. So I see Damien raised his hand, so please go ahead and unmute yourself.
Hi, Sarah. So the question was regarding the Medicaid, the already eligible Medicaid patients. So would this type of coverage be long-term, or is it more short-term? The one that they automatically have if they're already enrolled into Medicaid?
So for Medicaid only patients enrolled in like a mainstream plan, Medicaid only, they have long-term community home care coverage already with their Medicaid.
Okay, thank you.
I see that Angelina asked, will M11Q forms still be needed from doctors? So generally speaking, no. The only reason the M11Q will be needed to be filled out by the doctor is if applying for immediate needs home care. That hasn't changed. Other than that, M11Q forms will no longer be needed. It will be the new independent assessment process, and the New York Medicaid Choice doctor will fill out the order. Are there any other questions?
Sarah, under the new independent assessor process, what are the two assessments that's going to be done, and by what two agencies?
So it's the same agency, two assessments. So the first assessment is the nursing assessment. So the nurse will either in person or by telehealth from New York Medicaid Choice do this assessment. And it's going to be about the person's functional status, their need for help with different activities of daily living. Okay. The second assessment is the doctor's assessment. And that is also through New York Medicaid Choice. And that assessment is really to try to see if the person is going to be safe at home with home care, what their medical needs are, to fill out the medical order form for home care.
Thank you.
So those are the two assessments. Okay, Angelina asked, will the request for home care go directly to HRA or insurance companies like Health First? It really depends. So it's a complex answer because it depends on if they're in a managed care plan already, if they're applying for immediate needs. There's different processes for different patients. So I see a number of questions coming in now. Renee asked, what's the future of CD Pass program? So CD Pass is still available. Fiscal intermediaries are basically the agencies that pay the family members to be the aid. They're not allowed to advertise that CD Pass is available. And that's basically the strategy the state is taking to try to tamp down on CD Pass a bit, just preventing the advertising of the service. But it's still available. Patients can still do it. Nothing's changing there. Michelle asks, are there any regulations as to how quickly an MLTC has to respond to a request for increase in hours when a patient is hospitalized? Oftentimes they wait until the patient is discharged home, but without the extra hours. So it depends on whether it's requested expedited or requested just like on the normal time frame, but basically it would be anywhere between like 1 business day expedited for an inpatient admission to like 2 weeks for a regular request. And they are supposed to make that decision if necessary while the patient is hospitalized. The patient should not be discharged without a safe plan of care. Carol asks, can someone have CPAP home care and regular home care? So the answer is yes. You can kind of divide the services. So a certain number of hours for CDPAP with a family member, and then the rest of the hours through an agency with an aide. Janet has another question about CDPAP. Can a sister take care of someone and get paid? Absolutely, yes. The only prohibition is on spouses. Okay. Oh, this is a great question. So will the MLTC nurse no longer be doing any assessment? They will just review the Maximus assessments. So MLTC plans are still able to send their own nurses to do assessments if they want to, as like additional information. But there's no requirement. And they're really supposed to be looking at those Maximus or New York Medicaid choice assessments first, because that's the independent process. So we expect that the MLTC nurses are not going to be doing their own assessments for the most part. Renee asked, what will they do about existing spousal CD pass cases now? There really shouldn't be any. So if there were some that slipped through the cracks, that might have just been a mistake. This is not a change in the rule. This is what the rule has been. So I don't know if some people have been doing it anyway, but this is really what the rule has been. There shouldn't be those cases. So perhaps they just slipped through the cracks that you've seen. Okay, any other questions in the last few minutes that we have? So how can we get a copy of the rules presented in this presentation? So I'm sure we can maybe send out the slides to our partners so that they have this information. And of course, we might have to do another presentation as the situation changes, because a lot of times these dates change, things are updated, and it's just a really complex evolving sort of system. All right. Thank you so much, everyone, really for asking so many great questions and participating in all of the case studies. I hope that this information was useful for you. And if you have any other questions, you can always refer patients to Legal Health or reach out to us.
Sarah, we put our email in the chat. Can we get a copy of this like sooner than later?
Yes, I think so. I don't see any reason why not. I'll ask to have this slide sent out, and I'll just put my email in the chat in case you have any other questions, okay?
And
I'll
this
try
is
to
Julie Branfield. I just want to thank Sarah for her time and staying on top of the changes in home care. She does a terrific job just informing all of us about these changes. And for future trainings, please make sure you receive, if you don't already receive our monthly briefings or the email that announced this training, please email Allison Seidman, that's I'll put it in the chat, Allison Seidman, and you can get signed up for our newsletter and future trainings. You could email her for the link to the recording of this and for the slides as well. I'll put her in the chat.
Yeah, that would be great. Maybe if everyone could just email Allison for the copy of the slides. I'll make sure that gets out to everyone who wants it.
Can we have Allison's email again? I'm sorry.
I just put it in the chat.
Thank you.
Seidman, at NYLAG. And she'll post the link. She'll send around the link to the recording as well, in case you have colleagues who weren't able to join today and you think they would benefit.
Hello, quick question. My name is Abraham. I did miss, I think, presentation regarding SSI, SSDI. Will it be doing that soon?
Can't hear you right now.
Can you hear me now?
Yes.
Okay, yeah, something wrong with the mic on the screen. Yes, I know they did a presentation, if I'm not mistaken, maybe last week regarding SSI and SSDI for NYLAG, or was that a totally different division?
I can't remember what trainings we did last week, so we could have. Did you have a specific question about it?
Yeah, do they have those presentations as well for the SSI and SSDI benefits?
Yeah, you could email Allison. If not, we could do the presentation for you. I actually can't think if we did one. Where did you get it through our website, or was it through
Yeah,
Health and Housing Consortium?
along with this, I think it's regarding the social determinants. There were various different, I believe, presentations and trainings we were doing, and that was one of them.
Okay.
And
Yeah, I can't remember. We do a lot of training, so I can't remember what was going on last week.
okay.
But you can reach out to us or to Allison is a great gatekeeper and she'll know who to ask. And if you have questions on how to make referrals from the hospitals to our services, you could reach out to Allison as well, or we're in the process of posting updated information in our website. So in a week, that should be all up to date on how to make referrals as well.
All right, sounds good. Yeah, the specific date was Thursday, April 21st, and was asked a lawyer about SSI/SSDI benefits. Maybe it was just time to ask the lawyer a question.
Yeah, I'm not sure it was our office actually. But
Thank you.
you're welcome. But we do take those cases. So if you have cases to refer and you're at one of our partner hospitals, we do take those referrals.
Thank you.
Thank you, everyone. Once again, have a great day.